guys, I'm Dr. T and welcome to Dr. T's Corner. Alright, so to all my returning subscribers, I say welcome. Thank you for always showing up for me. And then my new subscribers, you're welcome. Thank you for joining this ride. You're going to enjoy it. Alright, so you're welcome to this episode. And this episode, we'll be speaking on the topic now that the baby is here, the postpartum days. Yeah, I know you guys are wondering what's this all about. Remember when we talked about labor? Yeah, when I taught you guys what happens during the labor process. So now you carried the baby for 9 months and now the baby is here. So what happens when the baby is here? I've noticed that many people don't know the things that happen, after giving birth. There are many things that happen. There are changes in the woman's body. There are things that they go through mentally, physically, and people don't really talk about that. Well, I'm here to bridge that gap, to teach you guys or to enlighten you guys about the things that happen during this period. All right. So if you have any friend that is about to get married, any intending mother, a, a friend that is in a very serious relationship leading to marriage, please share it with them. They need to know these things. They need to know. Okay, right. I'm pausing a bit. I'm waiting for you to share. You shared? Okay, let's get right into the video. All right, so what is postpartum, right? Postpartum is the period from birth to about 6 weeks after delivering your baby. All right, that's what they call the postpartum period. And a lot of things, happen during that time. A lot of physical things, a lot of mental things, and I'm here to walk you through it. Okay, so let's start. The physical things, some of the physical things that happen. Number one, pain. Now, when I say pain, it happens both with the spontaneous vaginal delivery and also the cesarean section. Okay, what do I mean by that? Don't worry, I'll break it down for you guys. So, SVD, which is spontaneous vaginal delivery, is when you give birth to your baby through your vaginal, okay, normal delivery, right? While the CS, the cesarean section, it can be elective CS. That means okay, it was scheduled for because of a medical condition, all right, or an emergency cesarean section that was scheduled for because there was an emergency. Maybe the normal labor did not progress, right? So with the two situations, there can be pain. So if it is SVD, there will be perineal pain. That means pain around the perineal region, around the vaginal region. There will be pain. Obviously, you just pushed out another human from your vagina. So yes, there will be pain around that place, right? And if it was a cesarean section that was done, the upside, the place that was incised to bring out the baby, you might have pains there, and it's normal. So it's a normal thing. So if a woman just gave birth, through her vagina, she's complaining of pain. I mean, it's a normal thing. So it should not be like, oh, why is she complaining of pain? It's something that we should expect. Okay. Also for those that are doing the cesarean section, it's something that we should also expect. So what happens? How can we cope this pain? It's simple. When you're leaving the hospital, you get pain medications, that are supposed to take at scheduled times, and then that would help. Okay. Some people they experience tear and they stitch them up, and they have to do some sit baths, just to help them. Sit bath means, sitting in warm water and salt to just try to keep that place clean, and just try to make it heal up quickly. Okay, so yes, pain is one thing that is inevitable. Okay, there's also breast engorgement, right? So these new mothers, they tend to feed their babies. Okay, and the more the babies suck the nipple, right, the more the milk comes to fill the breast, the glands, right? And when this happens, the breast becomes very full, sometimes heavy, and sometimes hard because it now constitutes a lot of milk, and then there is pain. Okay, so this happens, and sometimes you hear the new mother saying their breast is paining them, is engulfed, it's so full, it's so heavy. It is something that happens, it's a normal thing. So what can we do to curb this also? Okay, your baby cannot feed 24 hours of the day, right? So what we tell our mothers is to get a pump. can be a manual pump or an electric pump. Okay, I think an electric pump is better because manual you have to do it yourself and it can be straining. Okay, but the electric pump, you just fix it to the breast and then the electric machine just starts to help you pump the milk. So how you relieve this engorgement is to pump the milk out and store it in the refrigerator. Yes, milk can be stored. Okay, so it helps with the engorgement. That's two. Another thing is cramps. Okay, so you tend to feel things like menstrual cramps. Okay, but it's not menstrual cramps. It's called involution, uterine involution. So your womb is trying to go back to the normal size it was pre-pregnancy state. Okay, so the more your baby sucks, okay, there's a there's an hormonal mechanism, okay, which I will not really go into, but it helps your womb, your uterus to contract and go back to its formal size. So you might be feeling some cramp like pain. Some people say that, oh, it still feels like I'm contracting, but it's just milder. Yes, it's how your uterus goes back to the pre-pregnancy state. So you might feel those kind of cramps. Okay. Another thing you can feel is, or you can have or experience rather, is hemorrhoids. Okay, so some people call it pile in Nigeria, but hemorrhoids are when the tiny blood vessels around the anus, shoot out. Okay, and sometimes they are painful, sometimes severe cases they bleed out. Okay, um so what happens is that some people may have it before pregnancy, and during pregnancy is worse, and then during delivery, because of the pressure of pushing, is worse. Okay, so those things, hemorrhoids, it can occur, right? And then the things that we now tend to do, or things that we as doctors tell our patients, okay, um you don't want to complicate it. Okay, things that make you strain, things that get you constipated, you don't want it. So you take a lot of fruits and vegetables, take a lot of water, so that you are not constipated and so that you don't push it out more. Okay, sometimes you might be given an assault to just try to help with the area, to help with the area. It's a medication you put into your anus. We give you pain medication, we tell you to do sit bath, we tell you to eat a lot of fruits and vegetables to prevent constipation. If you're following all of this and it is not like you have a very severe hemorrhoid that you need to do an hemorrhoidectomy, that's removal of the hemorrhoid surgically, doing all of these things that we already laid down, most times you get a relief. The hemorrhoids, they can go back into the anus, and eventually you get some relief. But sometimes it might be as severe as having to do an hemorrhoidectomy. It will be removed surgically. Okay, so that can also happen. Now another, so those are some physical things. Okay, so another thing that is very important is sleep. You just gave birth, and your baby, you need to tend to your baby, you need to feed your baby, right? Your baby can wake up in the middle of the night crying, he wants to eat, she wants to eat. God bless you, you have twins or triplets, they want to eat, and you have just gone through a very tiring process. I mean, you've been carrying these children or child for 9 months, you finally delivered them, you just want to rest at least, but you see that you are not resting, right? You have poor sleep and all of this thing, you're attending to the baby and everything. And I mean, some people will say, okay, it's normal, you need to take care of your baby and all. Yes, it is normal, but there's something that can be done. This is when you need support, family support from friends, from family. So in Nigeria, the Igbos call it omugwo. I don't know if the Yorubas have a name for it, but the in-laws or the mother would go and tend and take care of the children and help and support the new mother. It is really important so that this mother can also have time for her body to recover, have time to have a good sleep and eat healthy, because all of those things are needed for her to even take care of the baby, effectively. So what do we advise? We need help around the house. Okay, we need somebody to carry the baby, we need somebody to bathe the baby, we need somebody to feed the baby. Remember that we can store the milk, so it's not every time. I mean, if the mother is awake and okay, and she can feed the baby with her breast directly, right? But remember that we are also pumping up milk to store. So if the mother is sleeping, you can feed the baby with the already refrigerated milk, right? You can't do that. So anybody can feed the baby. It can be the husband, it can be the sister-in-law, the sister, the mother, any other family member, any other friend can feed the baby while the mother actually takes a beauty sleep, eats well, rests so that her body can recover. Because most times you just, oh, she has given birth, she should start feeding baby. People tend to neglect the woman and focus on the baby, and that's not good. That's not good enough. The woman too is also a human being that has gone through a lot of stress. Her body has gone through a lot of stress. So she also needs to recover. Okay, so we need that support. We need somebody to wash the baby's clothes, somebody to bathe the baby. I'm not saying the woman will not do anything. She would, but she would do it when she feels very well rested and she can now do this stuff, right? So it's really, really important. So those are some of the physical, things that happen with the mother, right? There are some medical things that happen too. So there's something called postpartum hemorrhage. We already talked about what postpartum is. It's the period from birth to 6 weeks after birth, right? So when you hear hemorrhage is bleeding. So sometimes, um, whether it's a spontaneous vaginal delivery or it's a surgery, there can be hemorrhage, there can be bleeding. It can be bleeding right there immediately after birth. That's primary. It can be a secondary thing to the secondary hemorrhage. That means afterwards, not just immediately, after 24 hours and beyond, like maybe a week or two. So how do we manage this? So this is where the doctors, the professionals come in. We have to look for, after giving birth, we have to observe any bleeding from anywhere. Okay, if there is a bleeding, there's a tear, we fix the tear. If it's a bleeding, that if it's a CS that was done, and person is losing blood, the blood count after the surgery is still very low and is dipping, we need to check what's going on. If they need to go in, they go in and repair the bleed, right? So it's something that we always look out for, postpartum hemorrhage, so that we don't lose these patients. We have to observe, is there any bleeding after the delivery, after the surgery? So we do that as professionals. There's also something called preeclampsia and eclampsia. So preeclampsia is when the woman has very high blood pressure above 140/90 and presence of protein in her urine of 2 pluses, 3 pluses and above. Okay, now, it's called preeclampsia if this condition starts from 20 weeks of pregnancy, and even beyond, even after birth, like 7 to 10 days after birth. Okay, so that's called preeclampsia. So we watch it even from 20 weeks, and if there's a patient there, we already admit, we're already observing thoroughly. Okay, because if you don't do that and if you don't give some basic some medications that you're supposed to give, like magnesium sulfate to prevent seizure, which is now eclampsia, you know and if you don't give blood pressure medications to control her blood pressure, some people actually die from these things. Some people actually die from, because there's no cure per se. The cure, what really now resolves the preeclampsia, and preventing from going to eclampsia, is delivery of this baby. So it's something that so even when you now deliver your baby, we need to still watch within those 7 to 10 days and see, okay, is our blood pressure coming down? Is the protein in the urine reducing or resolved, so that we don't now have eclampsia, okay, at the end of the day. Now, another thing. Okay, so I think for now we've talked about the physical thing, what happens to the woman's body. We've also talked about the medical things. Okay, so now I think we can move on to the mental conditions. I know many people don't know about this, but that's why I'm here. Okay, to give you the tea, to give you, to inform you, so that when you're going through this thing, you know better. Pregnant women, they go on to give birth and deliver their babies. When they give birth, during this postpartum period, there are things that can happen to them mentally. It might not be so common, yeah, rare, but I have seen a few myself during these short years of my practice as a medical doctor. Number one is what we call baby blues. This happens within the first week of delivery, right? This is a mental condition where the mother is sad, teary, tired during that period. She's overwhelmed. And this is when you need a very, very kind and thoughtful and considerate partner and family and friends, because like people will not understand what you're going through. They might just be like, you just gave birth. It's a joyful thing. You're supposed to be happy. But they don't get it that because you don't understand what's going on with your body. You don't get it. But I mean, from now, knowing this, you might be able to relate that, okay, maybe this is what I am having. It's called baby blues. So you just figure out that you're sad, you're teary, you are not happy, you know. But for this, you just have to encourage the person, reassure the person, oh, giving birth is a good thing, your baby is healthy, just play around with the person and reassure the person. Really, before the end of the first week, the person would have come back, and be all vibrant and happy. But it's a condition and it happens. So these are things that we should watch out for. Okay. Another is postpartum depression. Now, this is like a graduation from baby blues. The woman is sad, the woman is teary, the woman is irritable, nothing makes her happy. The things that she likes to watch, maybe TV shows that make her happy, they don't make her happy. The foods that she likes to eat, nothing is making her happy. This period is from like 2 weeks of pregnancy, of delivery, to like a month and more. So now this particular one, the woman will might now need, what we call therapy. She might need to see a therapist. Person might need to talk to her, and if she's still not, coming around, she might now need to be on some antidepressant that will be prescribed by the psychiatrist. Yes. So, if you say pregnant, if you say a woman that just delivered and then she's not all vibrant and glowing and happy, she might be going through postpartum depression. So we should actually watch the things we say to people. We don't even know why this one is not happy after giving birth. What more does she want? She might be going through a mental thing. So can we just please have a little kindness, and try not to talk down on people or talk to people anyhow. People are going through stuff that you don't even understand, and they don't even understand in themselves. Now there's another one, and this is a scary one. It's called postpartum psychosis. Now, psychosis is is what people see as somebody is mad. People say it. So, but that's just layman. But it's when you're not in tune with your environment. Okay. Yeah, basically, let me just say it like that. You're not in tune with your environment. Maybe you're hearing voices, you're seeing things other people are not seeing, you feel like people are out to get you, things like that. People are inserting things in your mind, you feel like your thoughts are being hurt, things like that. Okay. Some of those symptoms are psychotic symptoms. Now, for postpartum psychosis, is longer, and then the woman starts to hear voices. She starts to feel like harming her baby. She starts to feel like maybe thinking of getting a knife and stabbing her baby, stabbing somebody that you just carried for 9 months and you just delivered. You know, it is. It's in fact, I'm short of words. And I've seen a woman with that condition before, and it's not easy, trust me. Nobody understands what's going on. Imagine, oh, you're newly married, you just gave birth after 9 months, and the husband is just coming back from work, bought some new diapers and everything, just to come to surprise the wife, and you just see your wife with the baby in the hand and a knife to the baby. I hate you, I'm going to kill you. And you're like, what? It's in fact, the man can have a heart attack, please, or he can just start begging that, please, what is the issue? Whatever you need, we will talk about it. she's having postpartum psychosis. She needs to see the doctor. She needs to be on medications. Okay, these things happen, and many people don't talk about it. But like I said, I have come here to talk about it, and I hope you all have learned a thing or two. So just a little recap: physical things that happen, pain, breast engorgement, uterine involution. So you'll be having little cramps. Your uterus is trying to go back to the pre-pregnancy stage. There's also hemorrhoids, poor sleep, tiredness, exhaustion. It happens. Medically, there can still be postpartum hemorrhage, there can be preeclampsia, there can be eclampsia, right? And then mentally, there's baby blues, there's postpartum depression, and there is postpartum psychosis. So these are one of the few things that I noticed that most postnatal women don't really know about. They find it strange, okay? But here, now you know it's not strange. And these things can be addressed, these things can be cured, okay? So I'm happy that you stayed to the very end. Please don't forget to like, share, subscribe, and comment down below. I want to know what you've learned. I want to hear your questions. I'll give answers to them. I promise to reply all of your comments. Don't forget to do what? Stay true, healthy, and beautiful. I'll see you in my next episode. Bye, guys.